Thank you very much for the question. Thanks for the kind invitation. Well, if you look at the literature, you can see clearly that the vast majority of the benefits and also on the data concerning related to the potential safety concerns refer to the mRNA vaccines, which are basically Pfizer and Moderna. So I believe that looking at the available literature, if we have to choose, if we can choose, we'd better opt for either of these two vaccines. Of course, there is no reason why we have 4 options. So if a patient had the Johnson & Johnson vaccine, that's fine. If a patient already had, let's say, first dose of the AstraZeneca vaccine, she can have the second dose. There is no reason why she shouldn't have this done. But if we can choose, I believe Pfizer or Moderna are the best options based on the available evidence.
Andrea, thank you very much. So the message there is a slight preference you're suggesting, but really there's no concern about any of the vaccines in pregnancy.
That's a very good question. Thank you. And well, we already know that antibodies passes through the placenta to the fetus, specifically IgA, and that's very important. And when born, the mother passes IgA to the neonate through the milk. But there have been also suggested that after several months, the people will need a booster vaccine because antibodies will decrease through time. And that's very important. However, if the question is that if the booster vaccine will protect the unborn baby, which is like kind of a tricky questions, I will say no, because probably due to the very low vertical transmission that we know, there will not, we still don't know there are consequences to the unborn baby, unborn. We will protect the baby after it's born, probably yes, but when it's unborn, probably it is not necessary. But anyways, the mother will pass IgA to the fetus, if that's the question.
Thank you very much. Yes, it's a slightly difficult question because the unborn baby, and of course this is all hypothetical, but you gave a very good answer there, Ray, so thank you. So this actually is quite an easy one to answer. Firstly, the mRNA cannot work itself into our DNA or baby's DNA. So there is no risk of altering the genes of a baby or a mother. So that's very important because often on social media, there's a lot about making genetic changes to the code of the mother and baby, and that simply is not the case. The second is that the mRNA gets into a cell and instructs the cell to produce lots of, for instance, the spike protein of the virus. So it's just really asking the cell to produce lots of material that becomes immunogenic and stimulates an immune response. And the mRNA does not cross the placenta. So on all those counts, vaccines are safe. They don't affect the genetic code of mother and baby, and they do not affect very unlikely to affect anything in respect of the so that is really the answer to that question.